So you recently gave birth, is that right?
I did. I have a 4-month-old at home.
4 months ago.
Mhm.
And before your birth, before your birth story that we'll discuss today, did you ever hear about preeclampsia or learn that term?
I had heard of it, but I didn't know much about it. This is actually my third child, and I had not experienced preeclampsia before, so it wasn't something on my radar.
And so tell us a little bit about how you learned about preeclampsia from your own experience.
Sure, I learned about it by running straight into it. Um, After what was a pretty rough pregnancy, in my opinion. Um, I was induced at 37 weeks and had a beautiful baby girl. It was the easiest and most pleasant birthing experience, which was nice. Everything went really well. I had a beautiful, healthy baby. I was what seemed very healthy as well. And I was just discharged after 2 days, pretty normal procedure. And then I started feeling some symptoms that were all justifiable, and really just passed up. So the first symptom I had were slightly swollen feet, but very slightly swollen, nothing extreme. I was very fatigued going up the stairs. I was tired midway through. Um, but I had just had a baby, so justifiable. I'm tired. I also had some headaches, but I always have headaches, so they never trigger anything for me.
So
And
let me actually cut in here, okay? You, up until this point, had what would we would actually term this in our documentation in the hospital as an uncomplicated vaginal delivery,
correct,
right? Before that, were you ever classified as having a high risk pregnancy?
I was. Mhm.
Okay. And I know a little bit about that story, but can you give me a little bit more for just the context of those just hearing your birth story for the first time? What was your high risk pregnancy diagnosis?
Sure. I was diagnosed through all three pregnancies with cholestasis. Um, The first pregnancy, I was diagnosed in the third trimester. The second pregnancy, I was diagnosed in the first trimester, which is pretty uncommon. And then this last pregnancy was in the second trimester. We had already been planning for it. And then it hit right when it needed to.
Oh boy. And so tell if you can to like people who are just not familiar with that term, what did it mean to you? What were your symptoms like?
The symptoms were extreme itching. It was terrible. I had to take a medication daily to not only help with the itching, but also to help with the bile acids that it needed to control. Um, Dr. Seagraves, I don't know if you could go into it a little bit more in medical terms of cholestasis.
Yeah. So cholestasis, from kind of a broader understanding, is that there's not a filtration of bile, from the gallbladder to the liver. And so stasis would be that things are not moving the way they should, right? And so for some people, it's very severe during pregnancy because it can actually lead to preterm birth. So baby being born before it should. It also lead to meconium fluid, which we don't want. It also can lead to a death of the fetus. Pretty severe cases is where that could actually happen. And so with cholestasis, there's just this filtering that's not occurring from bile from the gallbladder to the liver, and it can end up, from being itching is a main symptom. to pain in the upper abdominal area on the right side, right over where the liver and the gallbladder are. And then those symptoms can just really just affect growth of the baby. So in your case, from what I understand, you were recommended to deliver a bit early. Is that right? You didn't make it to full term. Was that for all pregnancies as well?
For all, I was induced at 37 weeks for all three pregnancies.
And you had a vaginal delivery for all three, or tell us a little bit about that.
My very first pregnancy was in a C-section, so because of fetal stress. And then we tried for a VBAC for my second, and it was successful, even though we had some complications. So I decided to try one more time, and this one was successful and pretty smooth.
And so this birth was actually pretty smooth compared to your first one, which was a C-section, your second one, which is a VBAC with complications, and this one, it was actually pretty smooth in
The
terms of your
delivery,
delivery.
the pregnancy, I would label as the worst, because on top of the severe cholestasis, I had a 5 week full blown 5 weeks of nausea and vomiting in the beginning. It was awful, as well as appendicitis. So appendicitis hit at week 9, so also right in the beginning, then started the cholestasis. And then I ended the pregnancy with symphysis diastasis, the pelvic pain that was maybe the worst. It was worse than the cholestasis, to be honest.
Let's were you walking at this time? Were you just in agony? What was that like?
Yeah, I cried a lot because I couldn't lift my left leg without being in severe pain.
Mhm.
And I couldn't roll over in bed without being in severe pain. It was awful.
So Alexa, when they decided, okay, 37 weeks, this is about as far as we want to go to, reduce the risk of fetal distress. Probably also considering that you were just in agony at that point. You were just having pain with just moving, just rolling out of bed, getting out of bed. Um, you delivered at 37 weeks. Was there anything during the delivery that, that happened that, was off at all?
During the delivery, everything seemed to go really well. They did the usual, let me see, they did the balloon, they did the Pitocin, the epidural, everything seemed to be going fine. Um, they did note that I had one mildly high blood pressure during delivery. I think that that's reasonable, I think. And then other than that, no, everything went well. The delivery was nice. Everything post and the 2 days following were great.
Okay. So Alexa, the reason why I had you go through that, and this is important so that you understand a little bit of the background of what I do, is that I'm primarily working a lot with maternal care teams to identify those individuals who would benefit from an occupational therapist and a physical therapist. Are you familiar with either of those professions in the hospital or even outside of the hospital?
I am familiar with physical therapists, but not
Okay,
occupational therapists.
occupational therapists. And so, occupational therapists, they're also rehab professionals. And so, what they're primarily looking at are kind of your roles and routines of your everyday life. And so, we know that caring for a baby, more than I do, right? I've actually not had the joy of bringing life into this world. But I do know that with the role of an occupational therapist, they're taking into account that caring for a baby is work. It involves a lot of demand, right? Like you're actually working, you're not sleeping the whole time through recovery. And so they're kind of helping you negotiate a lot of those activities of your daily life, whether it's showering for the first time if you've lost blood, whether it's caring for your baby, going up and downstairs, doing laundry, prepping meals, kind of like those high demanding activities that can be pretty demanding during the first few weeks after birth. And so a physical therapist would see you if you were still having that symphysis pubis pain with just walking. If you needed something to support you just during the first few days while you started to gain strength, we would check your vital signs with going up and down stairs. We would kind of do all of the kind of the gross motor and functional things that you would be expected to be able to perform without help once you returned home. And so I would say after everything that you described, even with the diagnosis of a high risk pregnancy, the fact that your birth was relatively uncomplicated, right? That you likely probably wouldn't have seen us, and you didn't. All three deliveries, you hadn't seen an OT or a PT in the hospital, right?
Correct. I had it.
So you're home now, and that's kind of where we're going to pick up the story again. You're home. You are experiencing mild swelling in your feet, is what you told us at the beginning. You have a little bit of a headache, going up and down stairs, you're able to do, but at what point did that change to where you're starting to notice getting a little bit out of breath? About what day after you gave birth, did you start noticing changes?
It would have been I started noticing the changes that first full day home. I was discharged day 2, so day 3 is when I started to really feel different. But again, justifiable. I'm home now. I'm moving more on my own. I'm up a little bit more maybe than I should have been. Um, Definitely day 3 is when it all started. Um, It also is when I started feeling this neck pain in the front and the side of my neck. Wasn't quite, I wouldn't describe it as pain. It was like a pressure, a throbbing even. Um, but we had talked about it. I had some other adults at the house, and we decided that it was just, from holding a newborn. I hadn't done it in 2, 3 years. So it was just a new strain, but it wasn't. It was true pressure and throbbing in my neck.
So this is day 3. This is the day after you went home.
That's when it started. And then the next day is when my sister had contacted me to send her my vitals. So day
Okay.
3, 4.
So this is actually relatively quickly. You weren't home for a number of days.
No.
This is actually the first day after you were discharged from the hospital. Uncomplicated vaginal delivery. You were walking around, kind of like settling into being at home. You have 2 other children at this point, in addition to your newborn. And how old are they?
I have a 3-year-old girl and a 7-year-old boy.
Okay. And they were totally leaving you alone because you had 2 other adults that were taking care of them. Is that right?
No, they love their mom.
So you had 3 children who all equally or maybe in different doses needed your attention right when you got home.
Correct.
Right. And what was your home like? How many levels to your home were you negotiating at that time?
It's 2-story.
Mhm.
My bedroom is upstairs, so I did have to go up and down the stairs, a few times.
Okay. And around that time, you are breastfeeding at this time?
I was a mix of both, but yes, I
Mhm.
was breastfeeding.
Okay. So you're holding your newborn. You and the other 2 adults, and who are they?
So my husband and then both of our mothers were here. So my mother and my mother-in-law.
So you actually had a house full. You
Oh,
had
yes, you did.
3 other adults
Mhm.
in addition to you. And so they're all in the home. They're helping as much as they can with the children who are also coming and seeking your attention. You're caring for the newborn. And you actually start feeling this throbbing, this pressure in the front of your throat, your neck, on day 3 after you gave birth.
Correct.
Okay. And so the next day, day 4, your sister, who is she now?
My sister is a nurse in North Carolina. She works at Duke Hospital and she checks in on me often. So she just happened to send me a text and say, "Hey, how are you doing? Checking in, send me your vitals."
Now, was that routine? Because I had not heard of that. And that's actually where I did my residency at Duke Hospital. So that's awesome. So a small world. So she was just doing this as a routine thing, or did
Yes,
she?
because she knows that I had a really rough pregnancy, and she's just so kind, so thoughtful and loving. Just my best friend. So yes, just checking in.
And just
And
ask for your vitals.
yes,
Alexa, I
she
have to say, I mean, that's not usual, even in families who have a health care provider in the home now. But did she work in OB care?
she does not. She works in critical care in the ICU.
How do we get that message out? Like just to even have just a family member ask for that kind of information. That's another piece to this puzzle, but that's phenomenal. So she's asking for your vitals and doesn't know your symptoms just yet, or does she?
I don't recall. I think I just told her I'm tired, the usual headache. And I think I did maybe mention a little bit of the neck pain, but yeah, just send me your vitals. And I said, okay, I will in a little bit. And I actually took much longer than I should have to send it to her because I had things to do.
Okay. And so at this point, do you have any swelling in your face, your hands, or anywhere else other than your feet?
Looking back at photos, you can tell that I was swollen. However, not noticeable enough to say, oh, that's swelling from an issue instead of just swelling from just giving birth and being pregnant.
Okay. You had headaches, but were they like throbbing, and where were they? Like if you could think back 4 months ago, where were your headaches mostly?
My headaches are usually in the front here.
And that's where you were experiencing them about 3 or 4 days after you gave birth.
Correct.
Okay. Were you having any other pain in your abdomen, in your shoulder, anywhere like that?
No pain in my abdomen. The neck pain, I remember saying it was like from my collarbone to my jaw.
Mhm.
And then just the headache. There was nothing else.
And then you had shortness of breath. When
Mhm.
was that primarily occurring?
Anytime I was moving.
Anytime. So not just when you were going up and downstairs.
That one was the worst. But yeah, just kind of going from the kitchen to the living room. I would sit down like, man, I'm tired kind of thing.
Okay. Now, so you
Yeah,
were taking your blood pressure at this time, like you were already actually taking your blood pressure from when you first got home, right, on day 2.
I did. Yes.
And what were
Just
what
out
were
of
your blood pressure?
curiosity.
Yeah, what were they?
So on day 2, I don't have it with me, but on the Sunday, so day 3 of the next day anyway, it was 140 over 80 was the blood pressure that I sent to my sister with a pulse of 47.
Were you taking your blood pressures before then? So before it was 140 over 87, did you say?
80.
140 over 80. Before that, were they that high?
I'm sorry, I didn't understand. I was not taking my blood pressures before. No,
Okay. In the hospital, did you take your blood pressure before? Or
they
did the
did
nurse?
take,
Mhm.
um, they did. I could pull it up if you'd like me to, but I don't have it on me. Yeah.
It wasn't that high.
No, they were all normal. Everything
Okay.
was in the normal range before I was discharged.
So when she saw that blood pressure, 140 over 80, what was her response?
She called me and she demanded that I retake it.
Mhm.
So I used a different blood pressure cuff and I retook it, and that one came out as 149 over 80 with 46 pulse.
And your pulse, normally, do you remember what it was?
My normal pulse sits between like 55 and 60. It's usually in the lower range,
Mhm.
but not in the 40s.
And do you have like a history of just being like really active at all?
Yes.
What is your activity of choice?
Used to be not as active as I used to be, but running. So I played a lot of soccer growing up and into adulthood, and just running.
Okay. And so your pulse sat normally lower than the average, 60 to 100 beats per minute is what we say, heart rate. But this was even lower than that. To be mid 40s and your blood pressure that high, 140 over 80, 140 over 89, right? And then a pulse of 46 beats per minute. What was her response with the second reading?
She told me to call the doctor that was listed on my discharge paper.
Mhm.
So I did that. I called them and let them know what I was having, and they asked me to do a third reading for them on the phone, and that one was even higher. It was 160 over 124.
160 over 124. And this is in the span of what time period would you guess? If you could
30 minutes.
remember. So 30 minutes from the time your sister is calling, asking for your vital signs, getting you to call your doctor who was on your discharge paperwork, and then you retaking the blood pressure went from 140 over 89 at the highest, 46 beats per minute heart rate, to now 160 over 121. Did I hear that right?
160 over 124.
124. What's your pulse at this point?
It was still in the 40s, 46-ish.
Okay. And so what happened after that?
She told me to come back to the hospital. There's a triage section in labor and delivery, and that's where I was told to go.
In our hospital, we call that the OBED, or the emergency department for the obstetrics unit. And that's probably kind of the equivalent of where you went. And
Sounds
so when you got to the hospital, do you remember them taking your blood pressure at that point?
Yes, and it was 159 over 88
Mhm.
with a 47 pulse. I remember the doctor calling the emergency department and asking if I should be sent down there for cardiac uh, reasons. And they said to no, to keep me up where I was in labor and delivery, and that a cardiologist would come see me there. And they decided to admit me for postpartum preeclampsia and acute heart failure.
So this diagnosis was on
Correct.
day four after delivery. At what point do you think your team could have helped you catch these signs, these symptoms, things that maybe now looking back at pictures, you mentioned you were swollen all over. You know, your sister was calling and checking in on you. You had three other adults in the house. But do you ever like think back at what point could the team have anticipated that this was happening?
I do. I think there were so many opportunities looking back. Part of it was on me too. I didn't want to come off as complaining or, um, you know, I just wanted to be home with the baby. However, the family at home could have seen the headaches, maybe weren't normal headaches. They could have seen the swollenness and told me, hey, give the doctor a call. Um, Anyone could have said, hey, let's take your vitals the first day home. There was a lot that we could have done. Even a call from someone from the doctor's office to check in would have made a huge difference because I would have said these things that I was feeling, and they would have most likely said, that's not normal. Let's get you checked out. Um, there were so many times that an intervention could have been taken place.
So you're in the hospital, you're admitted for preeclampsia, postpartum preeclampsia,
Correct.
and acute heart failure. And what medication are you given when you're in the hospital?
I was given magnesium, an IV magnesium drip,
Do you remember
along
how
with
long?
other. So I'm so sorry. They were also giving me a few things for the headache. But what did you say?
Do you remember how long you were on the IV drip for?
It was several hours. I remember they gave it to me at nighttime, and then I had it overnight. It was the second day in though, because they weren't sure about giving me the magnesium because of the acute heart failure side of things. So they wanted to get that cleared first before putting me on the magnesium drip. So the whole first day that I was there, all Monday, it was all cardiac kind of thing. And then that Tuesday is when they started or later that day is when they started that magnesium drip. So they started it at night and it went all night, so overnight.
And with the heart failure, I mean, that makes sense. Do you remember what labs they did to diagnose you with heart failure?
I the only one that stood out was the BNP number, which was 705. I think you had mentioned that it's supposed to be 300, 400.
Well, that's when you're definitely in heart failure, when it's above 400. But norms are usually anything below 1 to 200 is a normal BNP. And you were at 705. So that makes sense as to why they were addressing the heart failure first before putting you on magnesium. But then when they put you on magnesium, can you tell me a little bit more about your experience with that?
Sure. The magnesium caused terrible headaches. So I remember spending the night just with a blanket over my eyes, trying to drown out any light, any sound at all. It was terrible. And then around 6:30 in the morning, I needed to use the restroom. So I called the nurse in and she helped assist me to the restroom.
Do you remember still being connected to the IV at that time?
I was connected. She did disconnect it before helping me to the restroom.
Okay. The reason why I'm gonna ask you to kind of like walk us through as much as you can remember and then what you learned later um, is that I worked in the hospital and we had strict guidelines that uh, women were not supposed to be up and walking while on magnesium, right? So we had more of a less a policy that the nurses had. We didn't have to do anything as rehab therapists, as occupational or physical therapists. So they had bedside commodes in the room. Have you ever seen one of those or know what they look like?
Not personally, no.
Right. Okay. So in this hospital, I guess they didn't have that same policy. And so she disconnected you from IV mag, assisted you out of bed. And what do you remember after that?
I remember walking extra slow to the restroom, and we got in front of the toilet, and I just remember looking at her and saying, "I don't feel well," and then I fell onto her. So I had a syncopal episode that they documented as 5 minutes long.
And for you, that's your last memory, falling onto her.
Correct. That's the last thing I remember.
Did anything else happen during your hospital stay before you went home the second time that you can remember?
After that syncopal episode, they ran all the tests that they could think of. So I was getting scans left and right. Blood work was more often. The blood pressure was being monitored much more often. And they kept me for 3 or 4 more days after that to make sure that I wasn't going to have any more of those episodes.
At that time, was your family able to visit you during your hospital stay?
They could visit, but I was not allowed to have the baby with me unsupervised. So it was really hard on everyone. I couldn't have the baby there, and then my husband was back and forth because we had two babies at home, and it was the start of the school year.
How did that affect you just mentally?
Mentally, it was awful. I cried a lot. It was lonely. It was scary because I didn't understand a lot of what was happening. And then you go through this why stage, like why did that happen? Why was I allowed up? Um, what else could be wrong? Why didn't we catch any of this? It was just a very sad and lonely time that I think could have been prevented or less severe.
Alexa, if you could speak to your team, whether it was the delivery team, the team that cared for you right after your birth, before you went home the first time, or even the team that cared for you when you came back, what would you say?
Even after everything that happened, I'm still very thankful for the care that I received. I loved all of the nurses and the doctors that took care of me. I did feel like I was cared about and cared for. Um, but really, I would just say, even if someone looks okay, to just make sure to follow through. Um, I think that there needs to be, I know we had talked about this too, like a check in afterwards across the board for all um, postpartum moms, um, because you just don't know what can come up. And I had such a terrible pregnancy. It was almost expected that something was going to go wrong, you know? So I would have just asked, like, hey, can you call me and check in? Or I know that the message portal's always open, but that's still me reaching out as opposed to someone coming and checking in on me. Does that make sense?
Feels like a one-way communication line. It's a way for you to contact your team, but there's not the initiation on behalf of people who, like your sister, should just probably ask for your vital signs or ask how you're doing, right? I guess my question to you is, and this is something that I personally am facing now, I probably hear this the most, and it's that to do vital signs when moms are up and moving, like after birth, before they go home, that would be excessive. It would be kind of overuse of care and resources to be checking vital signs that often, especially if you had the delivery that you had, which was relatively uncomplicated. Looking back, what would you say to that kind of statement that it's excessive to be taking vital signs when someone is active?
I would just disagree. It isn't excessive, and if it can help catch something, why not? Especially for those moms who slip through the cracks and are or seem fine. Um, we're just hanging out at the hospital anyway for a few days, so what's wrong with just popping in and taking a stroll, a walk around the unit, and checking your vital signs? I would have no problem with that. And if there are people who are, they could politely decline, right? But I would think that the majority would be absolutely okay with someone coming in to check on me and make sure that everything is where it should be.
How about when you came back? Would you have expected that someone would have also just done that anyway before you went back home a second time?
Yes, and they did. Um, they had me taking walks a few times a day and doing vital signs before and after.
And did you feel like that is something that should be offered to every mom, or mostly moms who had the high risk pregnancy diagnosis, maybe an abdominal surgery? Like where do we differentiate who gets that kind of treatment and who doesn't?
I absolutely think that is absolutely, I think it's doable for all moms who just delivered. If they are feeling okay, go for a walk around the unit and let's see how you do. Instead of, okay, hop in your car and go home. Good luck. Because you
Mm.
can pick up on something like that. And it's a simple walk around the unit. It's not far. There's a ton of staff around to make sure that everything's okay. If it could help pick up on something, why not?
So Alexa, you're home now for the second time. How long did it take you to recover from all of this?
I would say I was not back to normal for maybe 6 weeks after this. We were also very scared, so we were taking my vitals all the time now. Really being careful of what I was doing, and we made sure that I was taking extra rest, which was a good thing. Um,
So you had even more like robust support, if not more people. You had just more people doing more for you. Is that right?
Correct.
Yeah. And
More
so you
people to step up.
were you cooking any meals?
I was not.
Were you doing any laundry?
I was not.
Okay. And with the children, other than kind of giving them the attention, they had someone that was helping them get dressed, helping them eat meals like that. How about just showering? Did that feel like it was taxing, or was it relatively easy for you to do?
It was taxing. It was it was exhausting. I remember showering, and while it felt wonderful to just get clean and be under the water, the hot water also was very tiring. Um, I remember showering and then always just wanting to go right back to bed for at least a week, maybe into the second week.
Just from one shower?
Hmm.
Yeah. Now, Lexi, have you ever heard of metabolic equivalency of tasks?
No.
Why would you? Why would you have?
Yeah.
That's a term I teach a lot of occupational and physical therapists. It was actually taught to me by an occupational therapist. And so those professions, they don't get a lot of fanfare. You didn't even know what an occupational therapist did you?
Not really, no.
And OT had to teach me that there's these activities that we all do, every human being. And there's an energy demand from every activity, from running a mile to running 7 miles to pushing a baby stroller up a hill to washing dishes and to showering with a hot shower. And I learned from that table of metabolic equivalency of tasks is that standing in a hot shower was as demanding energy wise. Like it took more, like as much energy as jogging at 3 miles an hour. Does that sound about right?
That sounds about right. Yes,
So just standing in a hot shower for you made you want to go to bed and rest for about a week.
it sure did.
To bring this to full circle, I'd like to ask you something just based on your knowledge now, 4 months out. I know that you've worked with physical therapy before outside the hospital, right? Given your experience, if there was a possibility that an OT, now that you know what an OT or an occupational therapist does, or a physical therapist, if there was an opportunity for that individual to come in and check on you in the hospital or in your home, what would you hope they covered or they did with you?
I would hope that they would compare how I'm doing sitting or laying in bed and how I am walking around the unit, making it as normal, as close to as normal as I'd be at home, with some movement, holding the baby even, um, and just comparing and making sure that everything's working properly, everything's in the normal range before I leave the hospital. Also some education too. I didn't know what to look for. I was on baby number 3. I'd never heard of anything neck related to look out for postpartum. So just really just checking in on my vitals, making sure that I seem pretty good to go, and telling me more about what I should look for would have been helpful.
At home, if an occupational therapist would have suggested, here is a chair that you can sit down on in the shower, would you have liked that option? Shower chair, shower seat?
I would have looked at them maybe like, I don't know if I need that until my first shower. Then I would have said, "Oh, I need that."
So you would have at least like someone to try.
Yeah, throw it out there. You don't know who will take that advice, right? And me personally, while I likely wouldn't have taken that advice that first time, it would have been in my head, and I would have said for my second shower, my husband, I need you to go get me something to sit on because this is just truly too much.
Yeah,
Just showering was too much.
yeah. Alexa, thank you so much for your story,
Of course.
for just sharing your experience, for all of it. If you don't mind, I'd like to have you stay with us as I kind of go through some of the closing thoughts that I have. And if you feel inclined to chime in based on what I say next, please do so. Feel free. I found that maternal care looks a lot like, and this is just from my experience, but our reaction to when someone loses a loved one. And it sounds so weird because those are two opposite events. One is bringing a baby into this world and you're really happy. And the other, you're losing someone. And the reaction I find from healthcare is that we don't want to impose. We don't want to cause that person to feel overwhelmed. So we actually withhold a lot of that attention that we would otherwise give, almost to the detriment of that person. And so when I first told you, Alexa, that a lot of my work is helping maternal health care teams identify who would benefit from our services the most, that's kind of a false statement, is because my work is primarily helping maternal care teams identify that any mom would probably benefit from being offered our services. Offered a bedside commode if they were put on an IV magnesium drip, because getting up and walking would put them at risk for what we call exertional hypotension, what you experienced, passing out and falling into the arms of your nurse, had she not been there, you would have fallen to the ground. I say that OTs and PTs offering their services in the home would actually be welcomed by the majority of moms because they don't know what they don't know. And they don't know that taking a hot shower is just as taxing as running 3 miles. And so rather than reduce access to our service because we don't want to impose, as we would if someone had passed away, I say when someone welcomes a baby into their world, whether it's their first child or whether it's their third or seventh, whatever it is, that we actually open up doors of offers and they can pick and choose, but at least they have knowledge that that help is accessible to them if they need it. And so in your case, what I would have done is had an OT and PT visit you, just even to say hi or introduce themselves as being members on your team. And hopefully from your maternal care team, either a nurse or the doctor themselves calling you, which you also identified as something that would have been helpful. I will say this, I guess, before you go. Have you encountered anyone else who is pregnant or expecting at this time?
I just found out that a coworker of mine is expecting.
How would you just go about with not scaring people with your experience? That's something I really want to work on. I think in 2024 is I've seen and I know too much now, but I still want to really celebrate this experience in someone's life. So how do you educate without scaring?
That is a great question. And it is exactly the question that I have because I haven't gone further than just the congratulations stage with her because I don't want to scare her, but I also want her to know what to look out for and to really advocate for herself. So I haven't decided how to go about that yet, but I am going to because it was just such a terrible experience. And maybe I can keep details to a minimum, but to really encourage her to reach out if anything doesn't feel normal or something feels off. Um, Also, let her know that I'm available. So you can call me if you need anything. I just went through it. Contact me. Um, but really to watch out for herself.
Would you recommend having a doula, even a postpartum doula that would call, that would likely call? You had an experience, you had not had experience with the doula either
I
of
have
your
not.
pregnancies. Okay.
Correct.
More to come on that, Alexa. I ponder this a lot because that's kind of the message. Message is in this, is behind the scenes, and it's we want it to package it up and not let it be scary, but we do want the message to get out that there's a bigger team that you might have to create before you even walk into the hospital, and that's okay. Wonderful. Thank you for your time.
Of course.